Assalamu alaikum everybody. My name is Dr. Maviz Aslam and I am mentor for FCPS 1 online course for ENT. This online course is a collaboration between StudyMate and MedExam Expert, and I welcome you all to our free webinar on paranasal sinuses. So first of all, we will be looking at some past CPSP MCQs. जिनको भी इसका आंसर पता है वो कमेंट्स में कमेंट कर दें फेसबुक पे, या फिर जो लोग हमारे पास जूम पे हैं वो चैट बॉक्स में टाइप कर दें. So the first CPSP MCQ is, which of the following sinuses are usually present at birth? A is sphenoid and frontal, B is maxillary and ethmoid, C is maxillary and sphenoid, and D is sphenoid and ethmoid. Whichever option you think is correct, please comment in comment section or type in the chat box. I can see some answers. We will discuss these MCQs in the end. So second CPSP MCQ is, maxillary sinus opens into superior meatus, middle meatus, inferior meatus, or the nasal septum. Okay, I can see some answers. We will discuss these answers in the end. Third CPSP MCQ is, which paranasal sinus is the first to develop in intrauterine life? A is maxillary sinus, B is frontal sinus, C is sphenoid sinus, and D is ethmoid sinus. And the fourth CPSP MCQ is, posterior ethmoid sinus drains into superior meatus, middle meatus, inferior meatus, or the sphenoethmoidal recess. Whatever you think is the correct answer, please type in the chat box. Okay, so looking at anatomy of the paranasal sinuses, what do you understand by paranasal sinuses? Para means around and nasal means nose, and sinuses are the air containing cavities. So basically paranasal sinuses are air containing cavities around the nose. We have 4 pairs of paranasal sinus. These paranasal sinuses are divided into 2 groups. We have an anterior group and a posterior group of the paranasal sinuses. Anterior group contains maxillary, frontal, and anterior part of the ethmoidal air cells, whereas the posterior group contains posterior ethmoids and the sphenoid sinuses. So if we draw a line here, dividing the ethmoids into 2, so the cells anterior to this line, these are called the anterior group of the paranasal sinuses, where the sinuses posterior to this line are known as the posterior group of the paranasal sinuses. So anterior group contains the maxillary sinus, the frontal sinus, and the anterior ethmoidal air cells. So what is common in these anterior group of the paranasal sinuses? The one common part is that they all open into the middle meatus in the nasal cavity. So इस लाइन के पीछे जितने साइनसेस होंगे वो होते हैं पोस्टीरियर ग्रुप में, जिसमें हमारे पास आता है पोस्टीरियर एथमोइडल sinus and the sphenoid sinus. The posterior ethmoidal sinus, it opens separately into the superior meatus, whereas the sphenoid sinus, it opens into the sphenoethmoidal recess. So this is a very important slide, and I can confidently say that you're going to get at least 2 to 3 MCQs in your part 1 exam from just this one slide. इसमें अगर आप देखें, this is showing the lateral wall of the nasal cavity. Lateral wall of the nasal cavity में हमारे पास 3 shelves होती हैं. एक, 2 और 3 shelves होती हैं. जो अपर शेल्फ होती है उसको हम कहते हैं सुपीरियर टर्बिनेट. देन वी हैव द मिडल टर्बिनेट एंड हियर वी हैव द इंफीरियर टर्बिनेट. हर टर्बिनेट के नीचे वाला जो पोर्शन होता है वो उसको मिएटस कहते हैं. इंफीरियर टर्बिनेट के नीचे होता है इंफीरियर मिएटस, मिडल टर्बिनेट के नीचे होता है मिडल मिएटस, सुपीरियर टर्बिनेट के नीचे होता है सुपीरियर मिएटस. वेरएज सुपीरियर टर्बिनेट के ऊपर जो एरिया होता है उसको कहते हैं स्फीनोएथमोइडल रीसेस. पहले जैसे हमने डिस्कस किया था कि anterior group of the paranasal sinuses, they all join together to open into the middle meatus, whereas the posterior ethmoidal sinus opens into the superior meatus, and the sphenoid sinus, it opens into the sphenoethmoidal recess. Inferior meatus में एक duct open होती है which drains the lacrimal secretions into the nasal cavity. It is called as the nasolacrimal canal. अगर इसको हम quickly revise करें, lateral wall of the nasal cavity में we have 3 turbinates, superior, middle and inferior turbinate. Below each turbinate we have area which is known as the meatus. Below superior turbinate we have the superior meatus. Below middle turbinate we have the middle meatus, and below inferior turbinate we have the inferior meatus. And above the superior turbinate, the area is known as the sphenoethmoidal recess. Sphenoethmoidal recess drains the sphenoid sinus. Superior meatus drains the posterior ethmoidal air cells. Middle meatus drains the anterior group of the paranasal sinuses, which include frontal sinus, maxillary sinus, and the anterior ethmoidal air cells. Whereas the nasolacrimal duct, it drains into the inferior meatus. So one by one, we'll be discussing the important points of the paranasal sinuses. So the largest paranasal sinus is the maxillary sinus. It is the first to develop in the intrauterine life. The largest in size, it is also known as the maxillary antrum or the antrum of Highmore. And maxillary sinus reaches adult size by the age of 15 years. इसमें दो चीजें याद रखने वाली है कि it reaches adult size by the age of 15 years. Its volume is 15 milliliters. Dental और ENT point of view से important है कि you can see that maxillary sinus are closely related to the roots of the molar teeth. So whenever there is an infection of the root of the molar teeth, there is a high chance of it spreading into the maxillary sinus. This is one important point which you should be remembering. Next we have the ethmoid sinuses. इसको हमने पहले भी डिस्कस किया that they are divided into two groups, anterior and the posterior group. Anterior ethmoids are part of the anterior group of the paranasal sinus, which all join together to drain into the middle meatus. Whereas posterior group, it drains into the superior meatus. Ethmoid sinuses are second to develop in the intrauterine life. Next, this is also again a very important table. इसमें अगर आप देखें, we have four sinuses: the maxillary, ethmoid, sphenoid, and the frontal sinus. First two sinuses are present at birth, where the last two sinuses are absent at birth. तो आप में से जो भी फुटबॉल के फैंस हैं, उनको पता होगा एक फुटबॉल प्लेयर है मेसी. तो ये एक निमोनिक है इसको याद करने का, मेसी फैन. MES stand for Messi and F stands for fan. M for maxillary, E for ethmoid, S for sphenoid and F for frontal. ये ऑर्डर है जिसमें पैरानेजल साइनसेस डेवलप होते हैं इन द इंट्रायूट्राइन लाइफ. इसमें अब आपको याद रखने वाली जो बात है वो ये है कि पहले दो साइनसेस they are present at birth, maxillary and ethmoid, whereas the sphenoid and frontal sinus are absent at birth. Maxillary sinus reaches adult size by the age of 15 years, whereas the frontal sinus, which is the last to start developing, it reaches adult size by the age of 20 years. Maxillary sinus first appear on X-ray at the age of 5 months, whereas the frontal sinus appear on X-ray by the age of 6 years. So these are some of the important points which you need to remember for CPSP MCQs. एक confusion होती है इसमें कि whether sphenoid sinus is present at birth or not. ग्रेज एनाटमी में और कुछ एनाटमी की बुक्स में लिखा हुआ है कि sphenoid sinus is present at birth, और कुछ ENT बुक्स में लिखा होता है कि sphenoid sinus are absent at birth. So basically there is a sphenoid cavity which is present at birth, लेकिन वो न्यूमेटाइज नहीं हुई होती है, उसमें एयर सेल्स नहीं फॉर्म हुए होते. जब एयर सेल्स फॉर्म होते हैं उसके बाद जब स्फीनोइड साइनस बनते हैं तब हम उसको स्फीनोइड साइनस कहते हैं. सो स्फीनोइड साइनस इज एब्सेंट एट बर्थ बट स्फीनोइड cavity is present at birth. So next we'll be looking at the functions of the paranasal sinuses. First function is conditioning of the inspired air. Paranasal sinuses में ऐसे होता है कि जब आप इंस्पायर करते हैं तो एयर लंग्स में जाती है, और जब एक्सपायर करते हैं तो कुछ एयर पैरानेजल साइनसेस में चली जाती है. नेक्स्ट टाइम जब आप इंस्पायर करते हैं तो ये जो एयर होती है मिक्स हो जाती है. सो जो एनवायरमेंटल एयर होती है वो ड्राई होती है, whereas जो बॉडी की एयर होती है वो ह्यूमिडिफाइड होती है और उसका टेम्परेचर थोड़ा डिफरेंट होता है. सो पैरानेजल साइनस की एयर जब मिक्स होगी इंस्पायर्ड एयर में तो उसके से बॉडी को एयर मिल रही होगी वो कंडीशन होती है. नंबर 2, दे ऐड टू द रेजोनेंस ऑफ द वॉइस. इसीलिए जो पेशेंट्स क्रोनिक साइनोसाइटिस या एक्यूट साइनोसाइटिस के प्रेजेंट करते हैं उनमें यू कैन नोटिस दैट एयर जो होती है, जो रेजोनेंस होती है वो कम होती है, क्योंकि उसको एयर की जगह वहां पे लिक्विड होता है। वेज नॉर्मल पर्सन में जो रेजोनेंस होती है वो ज्यादा होती है। तो क्रॉनिक साइनोसाइटिस वाले पेशेंट्स में हम कहते हैं देयर इज अ हाइपो रेजोनेंट वॉइस। So the third point is that they provide thermal insulation to the important contents of the orbit and cranium from temperature variation. As air is a bad conductor of heat as compared to solids, so paranasal sinuses provide thermal insulation to the contents of the orbit and the brain. Then, as air is lighter than the solid, so they lighten the skull bones. They act as buffer against trauma to brain. And last function is that they act as local immunological defense. So quickly revising the functions of the paranasal sinus. Number one, they condition the inspired air. They provide resonance to the voice. They provide thermal insulation to protect the important contents of the orbit and the brain. Paranasal sinuses lighten the skull bones and they buffer against trauma to brain and they provide local immunological defense. Then this is the last slide of the histology of the paranasal sinus. So you only need to remember this one statement that what is the type of epithelium of the paranasal sinus. Paranasal sinus is basically the respiratory epithelium which is ciliated columnar epithelium with goblet cells. इसमें अगर आप डायग्राम में भी देखें कि you can see that there are columnar epithelial cells which have cilia on top of them, and in between them there are some mucus secreting goblet cells. अब histology में सिर्फ एक चीज याद रखनी है that what is the type of epithelium of the paranasal sinus. So we have the ciliated columnar epithelium with goblet cells. So now we'll review the CPSP MCQs which were discussed initially. और अब देखते हैं कि आंसर्स improve हुए या नहीं. The first CPSP MCQ is which of the following sinuses are usually present at birth? A is sphenoid and frontal, B is maxillary and ethmoid, C is maxillary and sphenoid, and D is sphenoid and ethmoid. So whatever you think is the correct option, please type in chat box or comment on the Facebook comment box. Okay, I can see many correct answers in the Zoom chat box. So yes, it is B, maxillary and ethmoid. So you remember, messy fan, the first two letters are present at birth and the last two letters are absent at birth. So maxillary and ethmoid sinuses are present at birth. Second MCQ is maxillary sinus opens into superior meatus, B middle meatus, C inferior meatus, and D is nasal septum. Okay, I can see almost everyone has correctly answered that maxillary sinus opens into the middle meatus. So as maxillary sinus is part of the anterior group of the paranasal sinuses, which join together to open into the middle meatus. Anterior group of the paranasal sinus contain frontal sinus, anterior ethmoidal air cells, and the maxillary sinus. Third CPSP MCQ is which paranasal sinus is the first to develop in intrauterine life? A is maxillary sinus, B is frontal sinus, C is sphenoid sinus, and D is ethmoid sinus. So which paranasal sinus is the first to develop? Yes, again, everyone has answered correctly that it is maxillary sinus. Okay, so last MCQ for today is that posterior ethmoid sinus drains into A is superior meatus, B is middle meatus, C is inferior meatus, and D is sphenoethmoidal recess. So what is the correct answer? Okay, see, I can see many correct options that it is A. The posterior ethmoidal sinus drains into superior meatus. Anterior ethmoid sinus drain करता है middle meatus में, और जो posterior ethmoid sinus है, which is part of the posterior group of the paranasal sinus, it drains into the superior meatus. So this brings us to the end of our today's webinar. I hope it was of some help for you. तो आप लोगों के जो भी कमेंट्स हैं और जो फीडबैक है, काइंडली कमेंट इन द फेसबुक comment section or the Zoom chat box. If you have any question, you can comment in the chat box or in the Facebook comment section. Thank you very much.